when your mouth feels sticky, kind of dry, and it may cause trouble chewing, problems swallowing, even tasting your food, or even speaking. You feel like you gotta do that, right? For some people, they get cracked lips when they get a dry mouth as well. Your tongue can feel kind of rough and harsh. And sometimes this can lead to mouth sores, even infections in your mouth, even bad breath can happen because of dry mouth. By the way, I have a video on bad breath, and this is one of the things that can cause bad breath, by the way, dry mouth. So dry mouth is actually called xerostomia. It basically means you don't have enough saliva in your mouth to keep your mouth wet. This is the thing. It's not a small thing, though, guys. This is a big deal. Not only can you have problems with the chewing and the swallowing and things like that, it actually, dry mouth, raises your risk for tooth decay and infections. And you might be wondering, well, why? Why? Well, why is it a problem? Well, it's because actually saliva is super important. Saliva moistens our food. It kind of washes away gunk from our teeth and gums. It helps with swallowing, right? But saliva also contains minerals that help keep our teeth strong and helps fight tooth decay. So if you have a dry mouth, you need to know why you have it, and you need to work on fixing it with your doctor. All right, guys, by the way, I'm Dr. Jen. It is good to see you. We are talking about dry mouth. Now, by the way, in addition to telling you the causes of dry mouth, which I'm going to in a moment, I'm also going to tell you some treatments you may try, okay? Now, dry mouth, what causes it? Medications, huge, okay? If you've got dry mouth, not sure why, you need to go through your medications with your doctor. That's right. But also there are other things, certain medical conditions, certain syndromes, diseases. One is called Sjogren's syndrome. It is actually an autoimmune disease, characteristically causes people a dry mouth. But also things like HIV. If you've got problems with your salivary glands, even diabetes can do it. And the other thing is sometimes people who have undergone cancer treatments deal with dry mouth. So like if you've had radiation therapy, it absolutely can cause you to have dry mouth because of your radiation treatment. Chemotherapy can actually cause a similar problem. It can make your saliva thicker, cause your mouth to feel dry. But there's other things. You can have nerve damage in that area. Mouth breathing can sometimes cause a dry mouth. And then also the use of certain substances, things like alcohol, tobacco, or other substances can actually cause a dry mouth. All right. Now, the reason why I went through that before I give you the treatments is because it's super important to figure out what the cause of your dry mouth is. If you don't figure out the cause, you may not actually be able to get rid of the dry mouth. And that's why it was really important for me to go through those things and tell you all the stuff it could be. I actually have been dealing with dry mouth myself recently. It's actually one of the reasons why I decided to do this video. And I kind of came to the conclusion by looking at my different medications that my dry mouth tends to be caused by my migraine medication. I noticed when I had migraines, I took my medicine, I would just be drinking water, just drinking. And I was like, what is going on? And I realized the medication causes my dry mouth. So you've got to figure out the cause, work with your doctor to do that, because your doctor may be able to, if it's medications, might be able to change your medications, change the dose, do other things, okay? By the way, I should also say the source of this information comes from medlineplus.gov and the NIH. I think they have a really great description of dry mouth and just sort of reiterating why a dry mouth is really important to fix. You don't want dry mouth. It can contribute to bad teeth and bad breath and so many other things. Okay, let's talk about treatments, things that you can try to help your mouth feel less dry, help stay moist, okay? Is of course, you got to find the cause, but these other things may also be able to help with your symptoms, okay? First thing is drinking plenty of water, right? You're going to probably be doing that anyway. If you've got dry mouth, you're going to reach for the water. But the other thing you should do is to avoid drinks with caffeine, tea, soda, coffee, because caffeine can actually dry out your mouth. So that might be something that could be contributing to dry mouth, by the way. Another recommendation by the NIH is to consider chewing sugarless gum, or you can suck on sugarless hard candy. This might actually help stimulate your saliva flow, okay, from your salivary glands, so that might help. You want to avoid spicy and salty foods because they can actually irritate your mouth if your mouth is dry. Definitely avoid the alcohol and tobacco. A suggestion I really love that the NIH makes is to use a humidifier at night. And that might be especially helpful if you're like a mouth breather, because remember, breathing through your mouth can cause dry mouth. There are certain mouthwashes that are designed specifically for people with dry mouth. There's also prescription things that we might be able to give you as well. You want to talk to your doctor about that. But the other thing that the NIH mentions that I think is really great is, since dry mouth can really increase our risk of tooth decay, you got to make sure you're brushing and flossing your teeth regularly. And you got to see your dentist, okay? Dry mouth is not just an annoying symptom. It can actually wreak havoc, not only make there be problems with swallowing and chewing and tasting, all sorts of that. It can cause bad breath. It can cause you to have dental problems with your teeth. You don't want this. So I hope this was helpful. The main thing is you got to talk with your doctor about what the potential causes are so you can kind of get some definitive treatment, or at least definitively understand what's going on. So let me know. Was this helpful? Share this video with someone else if you think they might benefit from it. If you have a loved one or someone you know that's suffering with this. Please like and follow my page on Facebook. Write in the comments, by the way. I'd love to hear what you think if you go through this, dry mouth, etc. Write in the comments. Let me know. On YouTube, please subscribe to my channel. Click the little bell for updates. Also, guys, I'm on TikTok and WhatsApp and so many things. Speaking of which, I'm getting a dry mouth from all the talking that I'm doing right now. So here's my water. Actually, what's really interesting too is I get dry mouth when I'm giving speeches. When I do public speaking, it probably has something to do with nerves and stuff like that. So when I give speeches, I actually have to have a lot of water because my mouth gets so dry. But anyway, I'm on TikTok and WhatsApp and all sorts of other channels at Dr. Jen Caudle. Make sure you go to my website, drjencaudle.com, to sign up for my free health newsletter. Guys, hope this was helpful.